We're speaking this morning to Dr. Lleika Kunaselan. She is a medical doctor who actually beat depression not once, but twice.
Wow.
Good morning, Dr. Lleika. Now, Dr. Lleika, can you tell us a little bit more about yourself and what you do?
Okay, morning. So I'm currently a doctor with Kementerian Kesihatan Malaysia, with the government. I've actually just started being a doctor here in Malaysia. It's been about 4 months. I came back from the UK last year actually. I worked with the NHS for a year as a junior doctor. So I'm actually quite junior. It's only been about 1.5 months of working as a doctor, 1 year in the UK and about 5 months in Malaysia so far. That's what I do.
You beat depression not once, but twice. And the first time it happened, you were still a medical student. Can you tell us a little bit more about what caused, I guess, the onset of the depression and how it affected you as a medical student?
Okay, that was, I think, very, very tough because I was in medical school in the UK, so I was alone. I didn't have my parents, I didn't have my sisters, and it was very, very hard being so many 100,000 miles away, um, with a very tough schedule as well. Because I think we only had maybe 2 weeks off in the UK the whole year as a medical student. And it was a very, very tight schedule. You can imagine going in at 7 to the hospital and coming back at 6 in the evening and then having to study for the rest of the day. Onset wise, I think it came gradually. It was a lot of stress. It was being away from family. It was the weather in the UK. Winter is depressing. The sun sets at 3 in the afternoon. So that was onset wise. And I think I realized it quite quickly, actually. I lost interest in a lot of things. I wasn't eating well. I wanted to miss classes. I didn't study, and it was very obvious. And then the breaking point I remember very clearly one morning was I think I was scheduled to enter the operation theater. I think I was in my surgical posting at the time, and I just was waiting for the surgery to start, and I was sitting in the cafeteria or something like that. I can't remember, and I just broke down. I had at least about 6 surgeons around me just chatting away and having their breakfast, and I just broke down. I just couldn't do it anymore. I called Dad and I was crying and I was like, I really can't do this anymore. I know I only have about 6 months to go to complete medical school, but this is not what I want. It's all getting too much and I really want to quit. So that was the day I let my parents know that, look, things are actually quite bad and I really want to quit. So Dad got a bit worried. Mom got worried. Obviously, they were feeling helpless because I'm so far away. And I'm so fortunate to have that family support because Dad made the decision right away to fly Mom over. So Mom came to the UK and she stayed with me for about 3 to 4 months until I finished my medical school, really, and my finals.
What help did you seek and what treatment did you receive for that?
So in terms of help, we always break it down to conservative and then medical treatment. Conservative wise for depression, there's so many things that you can first do before you start yourself on medications. There are things called CBT, which is cognitive behavioral therapy. You can, if you're in the NHS, you can sort of call. I mean, if you're in the UK, you can call the helplines. And you can see sort of psychologists, clinical psychologists, counselors. What I did in medical school was there was a counselor on board in every university. So I spoke to her. It made me feel a bit better, but really I wasn't sort of 100%. So you can try conservative management first. You can seek support, counseling from anybody really, from a counselor or from friends, family. That doesn't help, then like it didn't help for me that much, or at least it helped for like say 1-2 days, and then it stopped. I feel depressed again. So I went to see the GP, and I got myself started. Well, or rather, the GP got me started on this medication called sertraline, which is first line for antidepressant and anxiety in the UK. So yeah, I got myself started on sertraline. For the first 3 to 4 weeks, you sort of feel a bit worse before you start feeling better. And I got better. I got my motivation back. I started feeling hopeful. My mood just started getting better. And yeah.
And we understand that your depression came back this year during the COVID-19 pandemic. I mean, everyone was going through a
Yeah.
bout of depression, I
Yeah.
think. Take us through that experience. Could you point to any triggers, like what triggered this relapse, I guess? Was it more severe this time?
So the first time around, obviously I had a trigger. It was the UK, being away from family, winter stresses of being a medical student. The second time around, so just a bit of a background. Once I came back from the UK, I had about a year off before I started working in Malaysia. So during that year, I didn't really have like a purpose. I felt I was very free, and I didn't really have a purpose. And I'm a very analytical person, so I need to keep doing something. I need to keep working or studying or doing something with my time, and I didn't. And it's sort of, I started overthinking, and overthinking for about 2 days, 3 days, 4 days, 5 days, and then slowly the low mood started setting in, and I was like, "Oh my God, here we go again." And it was about at the end of 1 month where I'd already planned to. It just snowballed out of nowhere, and yeah, at the end of 1 month, I was ready to take my life. Again, I was already thinking of different ways um, to die, maybe like pills, or I was actually actively researching um, and reading like journals and articles about the best way and the least painful way to kill myself. And that's when I told mom, I was like, "Look, like I will kill myself if it doesn't get better." And then again, mom got on board, dad got on board, and we saw the psychiatrist again. Actually, I stopped my medications when I started it in the UK because I got better, and you don't have to take sertraline lifelong. So I stopped after about 9 months. I tapered it down and stopped because I felt a lot better. So when it happened the second time, I was not on medications. So we saw a psychiatrist in University Malaya. His name is Prof. Amir. He's brilliant. And yeah, we restarted myself on sertraline. So I am on sertraline now, and I'm on a double dose. So I was on 50 milligrams the first time around. We tried 50 milligrams this time around, and it didn't help. So I'm on 100 milligrams this time around. And yeah, again, it took about 3 to 4 weeks to work, and I'm much better now. Um, and yeah.
But because you are a doctor, you were able to recognize the symptoms of depression. But recognizing the symptoms and taking action are two very different
Yeah.
things, right?
Yeah.
And we so often hear about people who don't seek help or they don't want to seek help. In both your bouts of depression, what gave you the push to decide that you need to reach out and get some help?
To say, look, it's okay. I know it happens. But in order to be accepting, you first need to have knowledge. You get what I mean? You need to have awareness, you need to have knowledge, you need to know what depression is, why does it happen, who can it happen to, how do we speak to someone who has depression, how do we help someone out who has depression. So awareness needs to be there. If there's no awareness, then there's no accepting. If there's no accepting, then there's no understanding. So awareness needs to be there. I think, like, for me, my parents were actually quite hesitant initially. They were like, oh, I don't think you need the psychiatrist, I think you just need to pray, and just pray and everything will be better. And I was like, no, I'm a medical doctor, I know exactly how it works, and I want to see the psychiatrist, and I want the both of you to follow me and see the psychiatrist. And they did. They followed me to see the psychiatrist, and it was really lovely because I managed to build this awareness in them. And they asked the psychiatrist so many questions about the medications and side effects, and they really, really, really did their research. And it's really funny now because it's my mom and my dad asking me every day if I've taken my medications. It's actually them reminding me, oh, you have to take your medications. Have you taken your medications? Make sure you take them. Make sure you don't miss them. And it's really funny because 3 months ago, they were completely against it. So like I said, it's awareness and it's understanding. And I just wish people would, sit down, maybe buy a book.
We read also that you're very close to your parents and you told them everything you were feeling and going through. Would you say that that was the main factor in helping you fight depression, or the very least make you seek help because you want to be there for your parents?
It's important to be accepting. It's very important to be accepting and to say, look, it's okay, I know it happens. But in order to be accepting, you first need to have knowledge. You get what I mean? You need to have awareness, you need to have knowledge, you need to know what depression is, why does it happen, who can it happen to, how do we speak to someone who has depression, how do we help someone out who has depression. So awareness needs to be there. If there's no awareness, then there's no accepting. If there's no accepting, then there's no understanding. So awareness needs to be there. I think, like, for me, my parents were actually quite hesitant initially. They were like, oh, I don't think you need the psychiatrist, I think you just need to pray, and just pray and everything will be better. And I was like, no, I'm a medical doctor, I know exactly how it works, and I want to see the psychiatrist, and I want the both of you to follow me and see the psychiatrist. And they did. They followed me to see the psychiatrist, and it was really lovely because I managed to build this awareness in them. And they asked the psychiatrist so many questions about the medications and side effects, and they really, really, really did their research. And it's really funny now because it's my mom and my dad asking me every day if I've taken my medications. It's actually them reminding me, oh, you have to take your medications. Have you taken your medications? Make sure you take them. Make sure you don't miss them. And it's really funny because 3 months ago, they were completely against it. So like I said, it's awareness and it's understanding. And I just wish people would, sit down, maybe buy a book.
Now, in your darkest days, right? How were you still able to pull yourself together to treat patients, and just go on with life?
It was very, very, very tough. Let me tell you, like, there'll be times where I think when I was under my psychiatry posting, it was my last posting in the UK, like, um, I would be seeing depressed patients, and I think at the time nobody really knew how I felt, and it was really quite sad because I was like, I don't feel like a doctor. I almost feel like a patient. I feel like you're depressed, and so am I. Um, but I think um, pulling through. I think I just kept telling myself I have to do this for myself more than anything else. I just have to do this for myself and just prove to that little voice in my head that I'm not good enough, that I am actually good enough, and I am enough, and I can do it. And that if I just pull through the next few months, I'll be done with medical school. And yeah, I think it's just constantly reassuring yourself that you are enough and that all those silly thoughts in your head are not true. Um, and back that up with all the support you can get from your family and your friends. And yeah.
Has your battle with mental health issues influenced your own work as a doctor? If so, in what way?
Yes, it has, because you become more compassionate, you become more understanding. You take that extra minute to sit and talk to someone on the ward when if you see them upset, if you see them sort of um, crying or upset or whatever it is. I know we're extremely busy as doctors, but what it's taught me is um, it doesn't hurt to spend that extra minute to go and sit next to your patient and ask them, hey, how are you feeling today? Like, you look a bit upset. Do you want to talk to me? Or is there something I can help you with? Or do you just need someone to just listen to you and, just go ahead and tell me all your worries and just sit next to your bed for an extra 5 to 10 minutes. Even if you finish at 7, it doesn't hurt like going back at 7:10, 7:15 if you've managed to make someone smile, or, like, just go to someone's bed and feed them their lunch or whatever. Like, just the little things. It's just so funny how the smallest things can make a big difference. Like when I was feeling depressed, I remember just maybe going out and one just a small gesture, like someone smiling at me or someone helping me um, do something. It's so funny how the smallest gestures can make someone's day when they're depressed, even when they're not depressed. So yeah, it's being more it's being kind and just helping others out and making others smile, I guess. Fighting a battle that you know nothing about. So it's about being kind, really. I think it teaches you to be kind. It really teaches depression teaches you to be kind. It does.
So, how are you doing now? Do you worry that your depression will come back? And how do you feel? You must feel really confident knowing that you have beaten this twice.
I'm okay, actually. It's funny because it's quite high and low, really. You have mostly good days, but you have your bad days as well. And I had a very, very, very tough schedule. The last few weeks, I was on the night shift, so obviously my sleeping cycle was disrupted. And when your sleeping cycle is disrupted, it can affect your mood and your anxiety. So the last few days, I've had a bit of a low, but I think I'm slowly coming back up again. But overall, I'm good. Motivation's there. I'm feeling hopeful and yeah, ready to make a change.
Now, what would you say is one of the biggest misconceptions about depression?
That it's a disease, that you are you're a bad person if you've got depression. And I think what I hear a lot about mental health issues are, oh, yalah, dia gila kan. Siapa nak jadi gila macam tu? Kesian kan? Who wants to be mad? And it's just a really bad thing to say, because you're not mad if you've got depression. You're not mad if you've got bipolar. You're not mad if you've got schizophrenia. Like, do you understand why a person's got that in the first place? Have you sat to them? Have you spoken to them? Like I said, there's so many different factors. So I think that's the biggest misconception. If you've got mental health, you're gila.
Finally, Dr. Lleika, what's your advice to anyone who might be struggling with this condition and they feel maybe trapped by it? And what would you say to the people who might have friends or family members who are battling depression right now but are not sure how to go about in helping them?
Okay, so for anyone struggling and feeling trapped, please speak to someone. Okay, don't feel like you're alone. You need to seek help. Okay, don't feel like you're a burden to anyone. You're not. Okay, you're not. And I just want to remind you that you've got a purpose in life. Okay, you've been brought into life, you've got a purpose. Each and every one of us have a purpose. and we're made for something. We're all made for something. So please seek help. That's the most important. If you don't feel comfortable seeking help from a friend or a family member, then there are hotlines you can call. You can call the befrienders. You can go to, there's a lot of help available. Go and see a psychiatrist, go and see a counselor, and speak to someone, get yourself diagnosed, or and yeah, just you need to speak to someone. You just can't bottle it in. Like, that's when the bad things happen. You have to let it out. And to the people around, it's about, like I said, and I keep saying, educate yourself. Read up about depression, read up about, bipolar, schizophrenia, anxiety. Educate yourself, and please be more open, please be kind. um, be very careful with the words you use. And yeah, just help, really, just help the people around you. Like, you're fine today, but you may not be fine tomorrow, so just help. And that help will come back. Be accepting, really, just be accepting. We're all different. We're not bad people, we're all good. Just be accepting and help. So you can first start off by telling them it's okay. It's okay to talk to me. I'm here to listen, I'm not here to judge. And when you talk to someone, you can always tell them, um, do you want me to just listen to your story, or do you want me to give you advice? It always helps to first ask them. If they Some of them just want to be heard. They don't really want advice, they don't want anything, they just want an outlet to let everything go. So it always helps first asking them, do you want me to just sit and listen to you, or do you want me to give you advice? So if it's the first, then yes, just listen to them. If it's the latter, then you can start giving advice. You can again ask them to go to a counselor, or speak to a therapist, or go to a government hospital, get an appointment with the psychiatrist. Speak to the psychiatrist and find out exactly what's happening, what your triggers are. And yeah.